Welcome to our 10 Essential Public Health Services group assignment video. Our topic is maternal, infant, and child health, and we will be focusing specifically on fetal alcohol syndrome in low-income areas in the United States.
The 10 Essential Public Health Services were developed through a collaborative effort of many public health officials and providers to establish a structured plan for promoting and protecting the public health of all populations with specific criteria. The essential public health services are grouped into three overall functions: assessment, policy development, and assurance. The following services will fall under the assessment function. The first service is to assess and monitor population health status, factors that influence health, and community needs and assets. To monitor alcohol use among women of childbearing age, the CDC uses the Behavioral Risk Factor Surveillance System. The BRFSS is a state telephone survey that uses random digit dialing to survey women ages 18 to 44 about alcohol usage to determine the potential number of women whose habits could affect their pregnancy. The survey includes questions about alcohol usage, meaning 1 or more drinks, and binge drinking, meaning 4 or more drinks on one occasion. The CDC works with various organizations to monitor women with high risk of FAS and look at outcomes of FAS. The CDC also looks at medical records and conducts epidemiologic studies to determine the number of instances of fetal alcohol syndrome for every 1,000 births. By collecting this data, the CDC can monitor the prevalence of FAS and analyze patterns in affected individuals. The CDC can also analyze the data to determine what methods and strategies need to be taken to prevent FAS and communicate these to hospitals, facilities, and their providers. The second service is to investigate, diagnose, and address health problems and hazards affecting the population. Doctors cannot diagnose fetal alcohol syndrome before a baby is born, but by screening the mother for alcohol consumption during various points in the pregnancy, they can determine the risk. Doctors can also look for signs of fetal alcohol syndrome by assessing the fetus's physical features and brain development. By educating women before and during pregnancy about the dangers of consuming alcohol while pregnant, they can decrease the prevalence in the population. Factors that can increase the risk for fetal alcohol syndrome in women is the age, gravidity, or the number of previous pregnancies, and parity, or the number of previous births. Among women who drink during the pregnancy, those who are higher in all the previously listed factors are more at risk for severe defects of the child during the pregnancy. Also, mothers with lower BMI who drink during the pregnancy also are at higher risk for more severe defects because the BAC, or blood alcohol concentration per drink, is higher than for those with higher BMI. Socioeconomic status is also a factor, with women who have lower incomes being at increased risk for fetal alcohol syndrome defects in their child, even when compared to women with similar drinking habits, which poses a danger for those in low-income areas. By identifying these additional layers of risk and collecting this information, interventions and strategies can be utilized and directed towards women with these risk factors to better prevent adverse effects.
The following services are under policy development. The third service is to inform, educate, and empower. We can inform people on fetal alcohol syndrome through advertisements in OBGYN clinics on the effects of alcohol has on babies and pregnant women. Public health. We can also inform people on FAS through public health announcements on TV and internet advertisements. We can educate people on FAS through open conversations and education provided by OBGYNs in their clinic with the first appointment with a pregnant woman, so we can stop the process or stop them from drinking alcohol. We can also empower people by providing women who are not currently planning on becoming pregnant with easy access to contraceptives, which includes birth control pills, condoms, and IUDs, so that women who do not plan on becoming pregnant don't become pregnant unknowingly and still drink alcohol because they are not in the known about their pregnancy. The fourth section of fourth service is mobilizing community partnerships. To assist lower income areas, communities can mobilize by connecting health clinics, schools, colleges, and community members to create a curriculum about the effects of alcohol during pregnancy.
Another category is to create, champion, implement policies, plans, and laws that impact health. The National Organization on Fetal Alcohol Syndrome, also known as NOFAFS, proposes for federal, state, and local legislation to help prevent and help those dealing with fetal alcohol syndrome. They collaborate with their partners and other stakeholders to advocate policies that will benefit the FAS community. The Utah House bill provides state and local services to pregnant women dealing with substance abuse to educate the public on this topic, as well as providing treatment services to them. They also support legislation that discourages consuming alcohol during pregnancy because of the health effects that it might have on the child. The Alaska House bill requires healthcare providers to notify law enforcement if the mother has exposed the fetus to alcohol. There are many efforts being made to increase funding for FAS for birth defects and developmental disabilities at the CDC. To utilize legal and regulatory actions designed to improve and protect the public's health, many state laws oversee alcohol consumption during pregnancy. For example, state legislation requires reporting and educating law enforcement agencies on pregnant behaviors. Under these laws, women who have been suspected or believed to consume alcohol during pregnancy have been arrested, civilly committed, subjected to forced intervention, or have lost custody of their children. To educate the general public on the effects of FAS, some state laws require warning signs in public areas to inform and raise awareness on the effects of public health. 24 states have made these signs mandatory, while other state laws provide services to women who have struggled from alcohol use prior and during pregnancy.
The next function we'll be focusing on is assurance. Service number 7 is linked to services and assure provision of services. In this area, healthcare providers should monitor pregnant mothers via blood tests and surveillance, especially since fetal alcohol syndrome is not able to be detected before birth. Healthcare providers should offer advice and inform mothers about the dangers of drinking while pregnant, as well as treat children with FAS after birth with medication for their symptoms, different kinds of therapy that are available via FAS specialists. Because fetal alcohol syndrome can cause lots of central nervous system related problems, as well as poor memory, vision and hearing issues, and learning and intellectual disabilities, there are several different ways to treat fetal alcohol syndrome. And specifically for low-income areas, Planned Parenthood facilities offer several different prenatal services and are good options for pregnant mothers living in low-income areas. Service number 8 is assure a competent public and personal health care workforce. In this area, you should focus on providing easily accessible information about FAS in low-income areas, and that it's important in preventing FAS-related birth defects, as well as having doctors and local clinics refer patients to an FAS genetic specialist if they believe there may be problems with a pregnancy or see signs of FAS after birth. This diagram here on this slide is very important in showcasing some of the risks of drinking while pregnant, and having several different posters like these up in low-income areas and doctors' offices in low-income areas can really help in informing.
The ninth public health service includes evaluating effectiveness, accessibility, and the quality of health services. New healthcare services have provided technologies to detect whether a woman has consumed alcohol or binge drink alcohol through pregnancy. To evaluate the effectiveness of these technologies, we have certain analysts test and give credible reports or data about the universal screenings for maternal use during pregnancy. Results from the evaluation's meconium screen test conclude that 84.2% sensitivity of the test, meaning approximately 66,500 women would be correctly identified. This supports the effectiveness of screening health care services that provide good quality services to patients. These evaluations can help lead up into ways in how to stop the spread of fetal alcohol syndrome from increasing. The 10th public health service includes research that can provide new insight and innovations to health problems. According to the Cleveland Clinic, drinking alcohol during pregnancy can cause changes in the biological composition of the fetus, which leads to birth defects, developmental disabilities, and learning disabilities. Innovations towards this particular health problem is Choices, which is a CDC evidence-based intervention program for women who are not pregnant but could be, and who drink risky levels of alcohol. Providing this counseling program helps reduce or stop drinking and or use contraceptions. This program serves as a motivation and a possible commitment to change. In conclusion, implementing all these corresponding health services can help and improve or reduce the issues of fetal alcohol syndrome. Here are our sources, which many include the CDC. Thank you for watching this video.